So I will focus more on the biggest victim of all, which is the patients, and the extraordinary callous and selfish motivation that is at the origin of such conduct. And let it be clear, this is not limited to the United States. It happens in every country, and I'll show you why. The reason is simple. Why is it so safe to fly? Why is there a bigger risk driving a car or being a pedestrian, being in a train or on a boat than flying? Because if a plane, a jumbo jet, would crash every 6 hours, nobody would fly. Hence, it creates an extraordinary pressure on the airline industry to make sure that it's safe. And there are 3 essential pillars to the safety in civil aviation. 1, if you take the case of Alaska Airlines that crashed in the Los Angeles Bay on its way from San Diego to San Francisco, the pilot lost control. The black box was found and determined that the bar in the wing and the back tail was broken, and so the pilot could not control and crashed. As soon as the FAA received that information, all DC-9s in the United States and beyond the United States, all over the world, were grounded. The manual of the maintenance of that plane was carefully checked, and sure enough, there was a mechanic who omitted to grease that bar as McDonnell Douglas, the manufacturer, specified had to be done. Hence, the FAA immediately ordered all DC-9s to be checked. 2 or 3 of those DC-9s had bars that were already cracked but did not break yet. Let it be very clear. There is no country that has any of those 3 essential pillars to assure patient safety. If we take the case of Israel, the case of Israel, it is very well known that actually an Israeli citizen is far more in danger in a car than it is in any military conflict. But it's not on the news all over the world. You hear a bomb here, a bomb there, a few things in Gaza. If you add up all Israeli that lost their lives since 1948, Independence Day, to today, it does not match the number of Israelis that died from car accidents. But guess what? That number doesn't match the number of patients that died only and solely from infections in hospitals, in Israeli hospitals. That doesn't account for all the other errors in Israeli hospitals. Now, I submit to you that if you're an economist, and an economist from MIT did that study a few years ago, so the numbers are surely higher than before, but how much do you believe any one of you is worth in terms of dollars as an economical portion of the economy? From the day you were born to the day you pass away, it's between $4 and $5 million US dollars, and that was about 20 years ago. You just do the math. And unfortunately, nobody's doing the math. If healthcare policy was guided by economics, then for sure, patient safety would be the number 1 goal. And as a consequence, physicians, nurses, and anyone else, including patients, whistleblower, would have full protection and anonymity, because the best protection is anonymity. If you don't know who provided the key information, which is exactly the case in the airline industry. I'm not inventing anything. The third pillar I did not mention is NASA. NASA receives between 30 to 60,000 incident reports per year from pilots, stewardesses, passengers, mechanics, but the FAA receives it in an anonymous fashion. The FAA does not know who provided the information. NASA does or doesn't. This is what we need in the healthcare industry. Now, what's a whistleblower? The word whistleblower, unfortunately, has negative, pejorative connotation. It's usually associated with a word like a snitch, somebody who shouldn't report things and make others look bad. Well, is anybody looking at Hans Brinker as a snitch? Has anybody ever looked at Hans Brinker as a whistleblower? No. Hans Brinker, who is Hans Brinker? A classic Dutch adventure. Guess what? Nobody knows about Hans Brinker in Holland. This is the brainchild of an American brilliant author called Mary Mabe Dodge, who actually wrote that book based on information that is real. Anybody wants to venture in the book of Mary Mabe Dodge what career Hans Brinker chose? He became a physician. So now let's look carefully at this image here. Now, let's try to think a little out of the box. All I personally see is a finger in a hole with a little water. What's the big deal here? What's the harm? So I see water going down, great. So that way the water benefit, the cow will drink it. So why this dramatic situation? Now, you know a coin has more than two sides. It actually has a circle around it. So now let's try to do the same approach here. Let's presume that now I am the largest Dutch contractor of dikes. And the Dutch are definitely number one in the world. As a matter of fact, the United States asked the Dutch to build a system of dikes in Louisiana after a hurricane that would devastated Louisiana. So they know their job. But let's look at economics. How much does it cost to fix a little hole? Nothing. Why not wait for the hole to breach and have a much more significant breach? Now we're talking. All right. Now we have some significant income. I see here an attorney from Romania smiling. She knows about that. So there's a reason why I'm asking you to think out of the box. I was once Hans Brinker. Eli Milgalter, sorry. Bless his soul, was Hans Brinker. I was extremely naive. I come from a family, my father was a brilliant international businessman, attorney by education. And I have academicians in my family, engineers. I'm the first physician among 20 or 21 cousins. So I went into medicine for the ideal. And I was shocked when I received a phone call from an attorney in Los Angeles who found my name, the Los Angeles Bar Association of experts in all fields, not just medicine, and asked me what I thought personally was the most stupid question I've ever heard in my life. Dr. Milikovsky, do you believe it is within standard of practice to remove both fallopian tubes of a patient without her consent? What? I asked her, where's your case? Africa, South America, India? She said, no, it's in the United States. Okay, Texas, where they do a hysterectomy on a young 26-year-old woman that has 2 kids. I trained in Texas. People in Texas think differently. The patients too. A patient in Texas would consider that as a contraceptive method. She says, no, it's not Texas. California. Oh, California, okay. Bakersfield, some hole in the wall. No. She says Tarzana Hospital. What? I'm at the Sinai Hospital for 14 years, never heard of that case that happened 3 years ago. All right, so obviously it did not happen in my department. So I asked her, was that a general surgeon's case? There was peritonitis, infection all over. Maybe it was a cancer specimen and the pathologist found the tubes? She says, no. It was an ectopic pregnancy. The pregnancy was in the tube as a result of a test tube baby procedure. Holy moly cannelloni. No, we have an expression in Los Angeles in such cases. We say, she must be smoking something. At that time, I must admit, I had great faith in the creativity and imagination of attorneys, as well as real estate agents in Los Angeles that can tell you there's a front ocean view when it's behind God knows where. And so I didn't believe a single word she told me. Why? Because I've been 14 years at the Sinai Hospital. I'm on the top of the pyramid. I'm in the Parent Charge Review Committee. This case happened 3 years ago. You want to tell me she knows something I don't? Guess what? I was in for a surprise. She did not imagine anything. Everything she told me was perfectly accurate. Now I had to ask a question she could not ask. How come she knows about it and I don't? I'm supposed to be reviewing complications. So I thought maybe I was in Israel, maybe I was in Europe, maybe I was on vacation when it happened. So I called all my colleagues in the department, only 120 OBGYNs. It's the largest department of obstetrics and gynecology in the north part of Los Angeles. And you know as well as I do, what I'm trying to say is that we physicians, for 14 years, were totally unaware of the fact that actually we are not in control of the quality of care in the United States. It is the administration and the governing board, and that's by law. Congress established it. The governing board doesn't even have physicians, and so it's all guided by economics. Now, Erika Hennig used to work for Goldman Sachs, and they figured, well, let's try to figure out what's the personality of somebody who becomes a whistleblower so we can neutralize them and eliminate them before they even say anything. Well, I told her, Erika, do you think I woke up one morning and said, hey, I'm going to be a whistleblower? That's not how it happens. What happens is the fact that the hospital suspended my privileges for no reason, illegally. When? 3 days after I went to the FBI. This is what makes a person a whistleblower. It's the retaliation against the physician. Now, why do I show you this beautiful picture? So that you can enjoy a little relaxing moment? Sure. But do you agree with me that Redding, California, a little village of 100,000 people, is really the environment like Canada and Switzerland that is prone to cardiovascular disease? No? You don't think so? Well, you're right. So explain to me how Medicare spends more per capita in Redding on cardiovascular surgery than in Houston, where you have two giants like DeBakey and Cooley, or San Francisco with Shamway. That makes no sense. How come Modesto? Same thing. Well, 83% of cardiovascular surgeries at Redding, 59-60% basically of bypass surgeries were performed on healthy people. Now, that's a good way to do business. You come healthy, you're still healthy, now you're going to be treated for something you don't even have. Now, in the case of Redding, and this is interesting to know because it could be applied in other countries, if you save to the federal government money, you get a percentage of the money the government recovers. Since the patients 65 and over are paid by Medicare, in this particular case, Tenet, which was the second largest private chain of hospitals in the United States, paid the largest amount of any chain ever in the world, which was in the United States anyhow, which is about $62.55 million to the Department of Justice. So 3 whistleblowers shared $9.88 million, 15% of that. Now this is interesting. Who are the three whistleblowers? One is an American priest. Why do I say American priest? Because before that he was a croupier in Las Vegas. He works in a casino. And he was a patient. He went to see this doctor called Moon, M-O-O-N, in Reading. And Dr. Moon told him, boy, you don't know how lucky you came today because you don't have any more than 3 or 6 months to live. So he didn't feel that bad. So he took all the X-ray, all the tests and everything. He took it to Las Vegas, checked with the cardiovascular surgeon, said, I don't see anything here. Then he double-checked and went a second opinion, San Francisco, nothing. So anyhow, look at what happened after 10 years. Realize that this happened for over 10 years before the FBI got involved, and Dr. Patrick Campbell is the one who provided the key information that helped the FBI. The stock of Tenet went down 95%, as you can see here. Now, I'll guys go fast forward and tell you just one more anecdote, briefly. Here's a hospital which is in Orange County, and it happens to have the highest infection rate post-operatively. Now, no surgeon is aware of the reason. No surgeon. Anyone wants to guess how come the administrators knows about it, the head nurse in surgery knows about it, and one additional nurse? I give you 3 guesses. No guess? Well, the sterilization equipment is so on and off. So there are 2 choices. Either we buy a new sterilization equipment. Oh, well, what's a big deal? Sometimes it works, sometimes it not. You know how much income that's generated? So the chief of surgery was called a day before, God knows how many years, some outside agency realized there was something a little cuckoo here, and then they explained to him the truth. But this chief of surgery was not in the pocket of the administration. He was also a professor at UCI, orthopedics, University of California, Irvine. He resigned. And he informed the Joint Commission. Now, everybody talks about accreditation. It's so beautiful. The same year I reported the Tarzana Hospital to the Joint Commission. And I called and I called, and I don't know why they don't ask me anything. And after 5 months, the nurse asked me, Dr. Milikovsky, what do you expect us to do? We are a not-for-profit organization. I said, what? I thought you were like the FDA or the FDA. I thought you were federal agencies. No. Smoke screen. Now, since apparently my time is over, well, this is just what the Joint Commission president at that time in 2002 thinking, there's no incentives for CEOs to achieve higher quality care as it would reduce revenues of hospitals. Now, this comes from the horse's mouth. Now, contrary to what you said you don't know anyone who died, a physician who died. In Oregon, 20% physicians licensed with specialty committed suicide. And this was in JAMA in 1980. So the chilling codicides, everybody spoke about it. Eitan Meiri, I'll just get to the last. Just realize errors is only 1.6%. It's nothing. But when you deal with 37 million records, 1.6% represents actually 600,000 patients. Fatalities over 3 years, and that's 6 million patients, 65 years and above. It doesn't take into account patients from 0 to 65. So we know that actually we have a Holocaust in the US healthcare, and nobody actually is treating it as it is. And so I will quote to finish Seneca the Younger, who said, to err is human, but to repeat the error is of the devil. I thank you very, very much. And this is, by the way, the motto of the Alliance for Patient Safety. You'll find it on our website. All that is necessary for the triumph of evil is for good men to do nothing. And the reason we chose this painting of René Magritte from Belgium, surrealist, is because it's called La Grande Famille. Why did I choose it? Because all of us in this room, including the hospital administrators, including their attorneys, one day will be patients. But they're not thinking about it. I thank you very, very much. I thank you for your indulgence.